For the estimation of best time to take a pregnancy test, one must first understand the biological process of pregnancy. Pregnancy does not happen instantly after got intimated. Many people mistakenly believe that they can take a test the day after having got intimated, but that is not how it works. Here's why. Fertilization takes time. After intercourse, sperm can survive in a woman's reproductive system for 4 to 5 days. However, for pregnancy to occur, an egg must be available for fertilization. If ovulation happens on the day of intercourse or within the next few days, fertilization may occur. But this doesn't mean pregnancy is confirmed yet. Implantation is the key to pregnancy. Fertilization happens in the fallopian tubes and the fertilized egg dividing and traveling toward the uterus. This process takes about 3 to 4 days. Once it reaches the uterus, it needs another 2 to 3 days to attach itself to the uterine lining. This crucial step is called implantation, and pregnancy is only considered established once this occurs. Implantation usually happens between 6 to 12 days after ovulation. Now the role of HCG hormone. Once implantation happens, the placenta starts producing human chorionic gonadotropin, that is HCG, the pregnancy hormone. This hormone enters the bloodstream and later passes into the urine. Pregnancy tests detect HCG levels in the urine, but it takes time for the hormone to build up to the detectable levels. Before implantation, no HCG is produced, so a pregnancy test will be negative. Immediately after implantation, HCG starts increasing, but it is too low for detection. About 7 to 10 days post-implantation, HCG level rise enough for detection in urine. So, when should you take a pregnancy test? The most reliable time to take a home pregnancy test is 1 week after a missed period. By this time, HCG levels are usually high enough for detection, ensuring an accurate result. If you test too early, the hormone levels might be too low, leading to a false negative. If your periods are irregular, wait at least 21 days after unprotected sex before testing. Then early testing, is it worth? So some sensitive pregnancy tests claim to detect pregnancy 6 days before you miss period, but these may still show a faint line or a false negative. If testing early, repeat the test after a few days for confirmation. Using first morning urine is necessary. For the most accurate results, use first morning urine because it is more concentrated and contains a higher level of HCG. Drinking too much water before testing can dilute urine, making it harder to detect the hormone. So how can you interpret the result of pregnancy test? If 2 lines, then positive result. A positive result means you are pregnant. Even if the second line is faint, it is still a positive result. If unsure, take another test in 2-3 days as HCG levels double every 48 hours. Negative result if 1 line. If the test is negative but you still miss your period, wait 3 to 4 days and test again. If periods are irregular, it could be due to stress, hormonal imbalance, or PCOS. If you strongly suspect pregnancy despite a negative test, consult a doctor for a blood test which is more accurate. Next, faint line on test. If you find a faint line on test, a faint line still indicates pregnancy but at an early stage with low HCG levels. Retest in a few days for a clearer result. Then now what to do after a positive pregnancy test? If you got a positive test result, confirm with a blood test. Blood tests detect even low levels of HCG. Now consult a doctor, start prenatal care to ensure a healthy pregnancy. Take prenatal vitamins. Folic acid is important for baby's development. Avoid alcohol and smoking. These can harm fetal development. So knowing when to take a pregnancy test is important to avoid false negatives and unnecessary anxiety. The best approach is to wait until you miss your period and then test a week later for the most reliable results. If testing early, always confirm with the second test after a few days. Understanding how pregnancy progresses can help in making informed decisions and reducing stress.